Hi, everyone, and good morning. Welcome to today's informational webinar on the California Healthcare and Homelessness Learning Community, made possible through support from the California Healthcare Foundation. Before we get started, I just wanted to thank each of you for being here today. We recognize that a lot is happening in California and in our country overall, and we hope that you're all staying safe. For reference, this webinar is being recorded, and we will post the recording and the slides to CHCS's website following today's event. Next slide, please. So we can actually go to the next slide. Just to introduce myself more formally, my name is Meryl Schulman, and I'm a Senior Program Officer at the Center for Healthcare Strategies. And I am joined virtually by the rest of my team who will be working on this learning community, including Rachel Davis, Kathy Moses, Matt Rawls, as well as our Program Officer at the California Healthcare Foundation, Michelle Schneiderman, who you will be hearing from shortly. Next slide, please. So we are just delighted to have each of you with us today. We have been working over the past couple of months to get this learning community off the ground, and so it's just really exciting to get to this point where the request for applications is live and we can share this opportunity with you. I do want to take a moment to thank the California Healthcare Foundation for supporting this work, and in particular to Michelle, who has been such a wonderful and passionate thought partner throughout this whole process, bringing her many years of experience working with people experiencing homelessness. So our hope for today is that for those of you already working on an application, that this session will be helpful and that will answer any questions you might have. And for those of you who are still deciding whether or not to apply, we hope that today's webinar will be encouraging. Before I turn things over to Michelle, I do want to acknowledge that we will do our best to answer as many questions today live. However, as you can imagine, we're typically in the same room for these types of webinars, which allows us to have more on-the-fly discussion. So just bear with us if we can't get to your question today. We will be following up early next week with an FAQ document that will be posted to CHCS's website, and we recommend that you reference that document when pulling together your application. So with that, I'm going to turn it over to Michelle Schneiderman, Director of High Value Care at the California Healthcare Foundation, to say a few words. Michelle?
Thanks, Meryl. Good morning, everyone. Thanks so much for showing up today on a Friday at the end of yet another challenging week for Californians. And as Meryl said, hope you and those you care for are safe from fires and their ongoing effects. For those who may not be familiar with us, I just wanted to take a moment to tell you about our foundation. The California Healthcare Foundation is a nonprofit independent philanthropy founded in 1996. We're dedicated to advancing meaningful, measurable improvements in the way the healthcare delivery system provides care to low-income Californians and those whose needs are not well served by the status quo. In particular, we are working to better integrate care for Californians who experience mental illness, substance use disorder, or other complex health conditions. And this past spring, we launched a new portfolio on improving healthcare for people experiencing homelessness. To achieve our mission and goals, CHCF needs to be able to influence how healthcare for Californians with low incomes is financed, regulated, and delivered. And to do that, we use 5 key capabilities: grant making, program-related investing, research, engagement, and convening. In our early stage work on healthcare and homelessness, we'll be focusing on the last 3 capabilities: research, engagement, and convening. And specifically as it relates to this meeting today, in an effort to better learn from people on or close to the front lines of providing care to people experiencing homelessness, and to learn directly from those with lived experience, we are delighted to be sponsoring this California Healthcare and Homelessness Learning Community. We could not be more excited to be working with the Center for Healthcare Strategies, an organization with deep knowledge about and experience with both Medicaid and the science of improving care for people with complex needs. And with that, I'll hand things back over to Meryl. Thanks, everyone.
Thanks so much, Michelle. So if we go to the next slide, I'll do a quick review of how things will run today. We'd like to share a brief overview of who we are at CHCS and the work that we do, and then we'll really get to the meat of the presentation, where we'll walk through the RFA, what we're looking for, as well as important dates and deadlines to keep in mind. We'll probably spend the first 20 to 30 minutes or so talking about the project, and then we'll be opening it up to take your questions through the chat function, or excuse me, through the Q&A function. Next slide, please. So as mentioned, everyone is on mute for this webinar and will stay muted due to the volume of attendees, but we encourage you to submit questions at any time through the Q&A icon located at the bottom of your screen. Next slide, please. So a little bit about the Center for Healthcare Strategies, or CHCS. CHCS was established in 1995 through a major grant from the Robert Wood Johnson Foundation to improve the underpinnings of the nation's healthcare safety net. And today our mission is to support innovations in care delivery and improve the health of low-income Americans, particularly people with complex health and social needs. And to achieve this mission, and you'll see on the graphic on the screen, we work with states, health plans, providers, community-based organizations, the federal government on three main priority areas. The first, integrating services for people with complex health and social needs. The second, advancing delivery system and payment reform efforts. And then the third, building Medicaid and cross-sector leadership capacity. And all of this is done, as you'll see on the slide, through best practice dissemination, technical assistance, knowledge development, and collaborative learning opportunities. Next slide, please. So this slide is really just to give you a sense of the selection of projects that CHCS works on related to our three priority areas. We have done a significant amount of work in California. Some of my colleagues supported a learning collaborative for the Whole Person Care Initiative. We've partnered for many years with CHCS on leadership and capacity building efforts, and have also worked with a number of California-based providers and payers, focused on various topic areas, including complex care management, trauma-informed care, physical and behavioral health integration, among others. Next slide, please. So I'd now like to take some time to talk specifically about the California Healthcare and Homelessness Learning Community. As you'll see on the next slide, this is a 12-month project. It's starting in October 2020 and running through September 2021, and of course supported by CHCS. And our main goal is to convene healthcare organizations from across California to learn from each other, but to also learn from other experts working across the country on innovative approaches to improving healthcare for people experiencing homelessness. And if we go to the next slide, we can see some more of our project objectives. And these are also outlined in the RFA for reference. So specifically, we're interested in supporting a shared platform for learning collaborative participants throughout California to learn from each other. We're also interested in identifying collaboration and information sharing opportunities at the local, regional, and statewide level. We're interested in educating participants on the policy levers, particularly at the state level, to address the healthcare needs of people experiencing homelessness. And we're also interested in connecting the folks working in California to experts elsewhere in the country, leading innovative work to accelerate the spread of promising approaches to improving healthcare for homeless populations. And lastly, and I think it's important to underscore this point, we're also looking through this learning collaborative to identify high priority areas for the field for both policymakers and philanthropy to focus on in subsequent years to better meet the healthcare needs of people experiencing homelessness. Next slide, please. So as you can see on the slide, there are four main project components, the first being monthly learning opportunities. So this includes things like group discussions, webinars, potentially affinity groups with peers and local partners. We'll also be having 2 virtual site visits, and these will potentially focus work happening in California, but it might also, they might also focus on innovative approaches happening elsewhere in the country. We will also be doing a lot of resource sharing throughout the Learning Collaborative, so we'll be passing around things like relevant articles, materials, and tools, and this will all be done through an online project portal. And then lastly, we'll be having conversations with local and national experts working at the intersection of healthcare and homelessness. And I should mention that in addition to tapping CHCS and CHCS networks, we're looking to partner with national and local organizations to expand our reach and to help enhance the project. And more specifically, we will be partnering with the National Healthcare for the Homeless Council on this initiative. Next slide, please. So this slide is just to give you a sense of the variety of topics we're hoping to explore through the learning community. So we may cover topics such as data sharing between healthcare and homeless service providers. We may also talk about, how can we better meet the physical and behavioral health needs of people experiencing homelessness. We may talk about street medicine and what that looks like in the midst of COVID-19. And I should underscore that while this learning community is not going to be specifically focused on the pandemic, we'll be looking to those participating in the Learning Collaborative to help us guide the content development. And so to the extent that COVID-19 is top of mind for some portion or the duration of the project, we'll want to work with those participating to factor that into the curriculum accordingly. Next slide, please. So on this side, you can get a sense of the anticipated time commitment for those looking to join the learning community or to apply for the learning community. So between monthly learning sessions, the 2 virtual site visits, potential affinity groups, and participation in CHCS communications products, such as being featured on a blog or presenting on a national webinar, we anticipate that those participating in the Learning Collaborative will dedicate on average 1 to 2 hours per month over the course of the 12-month project. Next slide, please. So this slide just gives you a sense of the eligibility criteria. California-based organizations working to improve the way healthcare is provided to people experiencing homelessness are encouraged to apply. And this includes folks that provide direct healthcare services or support organizations that do so. And I should mention that we are deliberately looking for an array of organizations. I think we've learned through our work, with various learning communities that actually having different types of organizations working in different geographic areas can enhance and enrich the conversations that happen throughout the course of the project. Next slide, please. So here's a selection of eligible organizations. Of course, this is not an exhaustive list, and if you have any questions about whether or not your organization is eligible to apply to the Learning Collaborative, don't hesitate to reach out to myself or to any of my colleagues. But a couple of organizations that are interested in pulling in are health and hospital systems, federally qualified health centers, community mental health centers, those providing medical respite or recuperative care, MC managed care plans, or associations and similar type organizations. Next slide, please. Okay, so a little bit about the selection criteria. This will be a competitive selection process. We will be pulling together an external review committee that will help CHCS and CHCS review and score applications. And ultimately, we will select up to 10 organizations for participation in the learning community. And we'll be using the following criteria that you can see on this slide to evaluate applications. So we're looking for a compelling statement of interest that clearly says, why your organization is interested in participating in the Learning Collaborative and why you feel this will be useful to informing your own work, but also what you feel you can contribute to the learning community. We're looking for organizations to describe their experience providing high-quality healthcare to people experiencing homelessness and their current approach to doing so. We're also looking to hear from you the extent to which the voices of people with lived experiences of homelessness inform organizational efforts and care delivery. And so if you are an organization that does not provide direct service, you'll see in the application that we have a question that asks, how does your organization incorporate lived experience into your goals and objectives? So regardless of the type of organization, we're looking to hear more from you on this front. And I should also add that at CHCS, we're thinking about how we can incorporate the voices of people with lived experience into the learning community and into some of the conversations that we'll be having as a group. So definitely more to come there. So if we go to the next slide, we can see the additional selection criteria that will be used to score applications. We're looking to hear from you your vision for improving the way healthcare is provided to people experiencing homelessness. And this can be at the organizational level, it could be at the county level, or even at the state level. We're looking to assess the strength and composition of the core team of folks participating in the learning community, and I'll talk more about the core team on the next slide. And then lastly, applicants will need to submit a letter of support from their organization's senior leadership, demonstrating that they support the core team's participation in learning community activities. Next slide, please. So I mentioned the core team in the previous slide, but you'll see there's more detail here on what specifically that means. So organizations should identify up to 4 representatives who will consistently participate in learning community activities. As possible, 1 team member should be in a leadership position, and 1 team member should be connected to work happening on the ground. So we're thinking of folks like case managers, peer specialists, frontline providers, what have you. And lastly, priority will be given to organizations that include team members for whom participating in this learning community will be a meaningful growth opportunity. So this includes folks like emerging leaders and those that are earlier in their professional career. And just before we go to the next slide, I wanted to mention, and you'll see this noted in the application, that while the core team will be the primary group of people participating in learning community activities, we will be encouraging encouraging organizations to pull in colleagues for certain conversations as relevant to their positions and areas of expertise. Next slide, please. Okay, so this slide just gives you a sense of the immediate timeline for the project. So letters of intent to apply are due to CHCS by September 16th. The application and supporting materials are due to CHCS by September 25th. Notification of selection will likely happen on October 9th or sometime around then. And then our first learning community kickoff webinar will take place on October 29th from 11 to 12 Pacific Standard Time. So if you are applying for the learning community, we ask that you mark your calendar for the learning, for the kickoff webinar in case you are selected for participation. So with that, we will turn it over to the Q&A portion of this webinar. Before we open it up to the questions that you've submitted through the Q&A function, there were a few questions that were submitted ahead of the webinar. So if we go to the next slide, I will just answer those for the people that submitted those questions. And I should also, I should have mentioned that we think that we covered some of the questions that you submitted ahead of time in our presentation. If for some reason we have not answered your question substantially, please resubmit it through the Q&A function. So the first question, what level of experience should participating staff have and what skill set is required for participation? So in regard to the level of experience and skill set, I would refer back to the details that I just shared on the core team. If possible, we want one member from a leadership position, and we want one member on the core team to be connected to work happening on the ground. And I think overall, we're looking for people who are really dedicated and committed to improving healthcare for people experiencing homelessness. So the second question, will there be regional opportunities for collaboration across counties or continuums of care? I think that this depends on who ends up participating in the learning community, but CHCS will definitely be looking to make local and regional connections across counties and continuums of care. And we're also thinking that the potential affinity groups that I mentioned may be a natural opportunity to do so. We also definitely imagine co-creating the curriculum for this initiative. So if this is of interest, please highlight that in your application. So this next question, will there be a listserv established for ongoing collaboration? So I'll answer this two ways because I'm not sure if this is specific to the folks that are participating or just the larger network of people providing healthcare for people experiencing homelessness. So participants in the learning community will all have each other's contact information to stay in touch following the learning community. For those outside of the learning collaborative, we won't have a listserv for folks to join, but we will be disseminating learnings through various communication products. So we definitely encourage you to sign up for both CHCS and CHCS emails to receive those products. And then this last question, how are we responding to or planning for needs of the urban homeless who have no family to turn to for shelter? It's a great question. We definitely expect and hope that we will be able to get a mixture of sites from urban, rural, and suburban areas, and we fully anticipate talking about opportunities to support people experiencing homelessness in each of those settings. So hopefully I answered those questions, and we'll now turn it over. We can actually go to the next slide, Matt, and we'll start to take questions that have been submitted throughout the course of this presentation. Just give me a second to pull those up. Okay, so can an individual participate or is a team required? This is a great question. I think technically in the RFA, we say that the core team can consist of up to 4 members from an organization, but I think we would probably give preference to an organization that has multiple members of their team participating, given that we're looking for, if possible, 1 member from leadership and 1 member who's more directly connected to work on the ground. But maybe I'll open it up and see if any of my colleagues want to add something here.
Yeah, Meryl, this is Rachel. David, thank you for this question. So actually, I think we're very squarely looking for organizations to apply for this learning community, and so we're casting a really wide net in terms of what we mean by organizations, but we would not be looking for a one-off individual who's not connected to a broader organization or a broader team or set of efforts in California. So hopefully between that answer and Meryl's feedback, that's clarifying, but please feel free to submit a follow-up question if we didn't cover that.
Thanks, Rachel. So there's another question here from Betsy. Thank you, Betsy, for your question. Are children experiencing housing insecurity in scope for this project? I would answer yes, and I would encourage you to include in your application topic areas or certain populations that you're interested in focusing on, because as I mentioned previously, we're definitely looking to co-create the curriculum with those that end up participating. So we have another question here from Erica Rogers. Thank you for submitting this, Erica. Can a THC consortium make a team with a member FQHC? So I'm assuming that's a community health center consortium. It's a really good question. I have to say that this is not something that's come up for us internally. So if it's okay, Erica, we'll answer this question through the FAQs after we have a chance to caucus after this webinar. Okay, so we have another question from Betsy. I'll just read it out loud. Cal Optima's Homeless Health Initiative partners with several community partners, including FQHCs, shelters, OCHA, et cetera. Can we apply as a collective, or should some of these entities submit their own application as well? So another good question, and I imagine that this is something that that others are wondering. Similar to Erica, I think it's best for us to talk amongst ourselves as a team and get back to you through the FAQs. Sorry to not be able to answer that on the spot. So we have another question here from Lauren. Can you share the link to the RFA? It looks like Rachel has provided you with the link, but yes, all materials can be found on CHCS's website, and you can also go to CHCS website, and that will direct you to where the RFA and the application and other materials are located. So I don't see any other questions in the chat. Hopefully that means that we gave a thorough presentation and you know, your questions were answered. Maybe I'll give it a little bit of time to see if other questions come top of mind to folks, and if not, we can wrap up the webinar. But I will say that, you know, as you're working on your applications and even your letter of intent, if you have any questions at all, don't hesitate to reach out to anyone on the CHCS team.
Meryl,
Okay,
this is Rachel. While we're, I'm sorry, I was just, while we're waiting for, to see if folks have additional questions, one thing that is probably worth pointing out is, just to be explicit here, the letter of intent to apply is non-binding. So I would encourage folks on the line who are leaning towards applying and you know, or may still need to figure out if they can pull together the resources or the commitment or what have you, to still submit that letter of intent. Obviously, that helps us understand how many applications potentially we're going to be receiving at the end of the day. And again, it's non-binding. So if you submit it and you end up not ultimately deciding to apply, that's fine. But it's really helpful for us to have folks complete that to the best extent that they have a sense that they're going to be interested in applying. So just wanted to underscore that point.
Thanks so much, Rachel. So we received a couple of more questions. Megan is asking, how many organizations are you expecting to be part of the collaborative? Great question, Megan. So we are expecting up to 10 organizations to be selected for participation in the Learning Collaborative. Just scrolling through here. So Lauren is asking, do we have to wait to hear back if our letter of intent is accepted before we send in the application? So no, Lauren, you do not have to wait back to hear if your letter of intent is accepted. As Rachel said, the letter of intent is really useful for CHCS for planning purposes, particularly because we do a competitive selection process. And so we can't anticipate how many applications we'll receive. So we will not be following up. We will acknowledge that your letter of intent was received, but you know, your letter of intent won't be quote unquote accepted before submitting the application. Thank you for that. So another oh, sorry, Rachel, did you want to add something?
Go ahead, no, sorry.
Okay. So another question around letters of intent, will the content of the LOI be considered in the scoring, or will the score be based on the application? So the letter, it's a great question. The letters of intent are not factored into the scoring for participation in the Learning Collaborative. We strictly use the applications and other supporting materials, like the letter of support from leadership and the CVs from the core team.
And Meryl, just to chime in here again, one thing to underscore along these lines is that both on the letter of intent and frankly the application itself, we very intentionally tried to make this a fairly low lift effort. So this is not an application where folks, where we anticipate folks needing to spend like 10 hours pulling this together. There's a core set of very succinct questions, we really try to focus in on the elements that we think are most important to help us understand your interests and what you might be able to bring to the learning community value add contribution-wise. But just to underscore, I think we recognize there's so much going on right now, as Meryl said, in the state, nationally, between the pandemic and just the current wildfire situation here and all the other normal things that you all deal with caring for this population. So just want to underscore that our intention and hope is that at the end of the day, this is a fairly reasonable application process, and that includes the letter of intent.
Thank you, Rachel. So we have one other question here from Linda. Thank you for asking this, Linda. We are a small rural healthcare for the homeless program that started 2 years ago. Would the learning community be interested in relatively small and new programs? Thank you. I would encourage you, I would not discourage you from applying because you're a newer program. As I mentioned in the selection criteria, we will be looking at your experience, but also your current approach to providing healthcare for people experiencing homelessness. And we definitely are looking for providers working in an array of geographic areas, so rural, urban, and suburban. So the fact that you are a new program, I would not discourage you from applying because of that. I don't know, Rachel, if you wanted to add anything there.
I think that was great. I mean, Meryl, I think you spoke earlier in the webinar to the point that in our experience as the Center for Healthcare Strategies running learning collaboratives like this, we've found that there's a lot of value add in having a real range of organizational types that participate in these things. And so I think there's, potentially a really wonderful perspective that you could bring to bear here, being in a rural area, but also being, in the newer stages of getting yourself established. So absolutely would encourage you to apply.
Great. So I don't see any other questions coming through the Q&A function. I'm going to give it a few more moments in case folks are typing or something comes to mind.
Michelle, let me also just check in with you to see if there's any feedback or comments you wanted to add after hearing some of these questions or contemplating some of the webinar a little bit further.
No, thanks, Rachel. All great questions. Appreciate the answers. I'm looking forward to digging into the questions about cross-organizational partnerships. I think those are great questions and really important. And I'm just really excited about this opportunity.
Thanks, Michelle. So we have one more question that crept in. Diana is asking, where can we access this webinar? So the webinar, the slides, and the FAQ document that we referenced will all be posted to CHCS's website on the project page for the California Healthcare and Homelessness Learning Community. I believe that link has been entered into the chat. So that is where you will find the recording following this presentation. I should also note that anyone who registered for this webinar will receive an email that will provide that link. Great. Okay, so I don't see any additional questions coming through. Maybe I'll just give it a few more moments before wrapping up in case there are any lingering questions. Okay, I think we can go to the next slide then. You know, just as I mentioned, if anything else, you know, oh, I'm so sorry, one more question just snuck in. Samson is asking, we are a healthcare for the homeless FQHC clinic and we work with other CBOs. Can we include the other organizations in this project? I really appreciate this question, Samson. I do think that I'm going to hold this one for the FAQ document, similar to the other questions that we've received about organizations applying as a team. So we'll definitely get back to you on this, and we can add that to the list. Okay, so as I was mentioning, don't hesitate to reach out to me. My contact information is up on this slide. It can also be found in the RFA and the application. Thank you all so much for joining us. I really hope that this presentation was informative and encourage you to consider applying for this opportunity. I want to thank my colleagues on the line for helping to field questions and helping to prepare for this webinar. And then lastly, to Michelle and her team at CHCS for making this webinar possible. Thank you again, everyone, and have a great day. Thanks, everybody.